Hello, my name is Jacob Braddock. I'm the paramedic instructor here at South Plains College. I'm going to be giving a brief presentation today about some of the strategies that we're currently using to make our program better and in turn improve our students' understanding of the information, their retention, and their pass rates. I myself was a graduate of the EMS program as well as a part-time instructor here at South Plains College prior to accepting the full-time position. So I've had the opportunity to see the program progress through a lot of changes. A lot of that change does come with technology. As with most areas of healthcare, technology is constantly changing, and we must embrace these changes if we stay up with the times. Some of the equipment that we're currently using in the EMS program mimics a lot of that's being used in this area EMS systems. The first is a King Vision laryngoscope. This device is a disposable blade that can either have a channel or unchannel to hold the ET tube, kind of depending on the situation. This device allows the provider to stand at a farther distance, which is a little safer for themselves, as well as see through copious amounts of blood, vomit, mucus, or whatever may be in the airway, which would make a traditional intubation very difficult. The next piece of technology that we use is the EZ-IO. This is a battery-powered device which allows the provider to obtain interosseous access or place a needle in the bone when an IV access is unattainable. This is a very fast and reliable way to obtain access whenever every second counts. The EZ-IO comes packaged with pretty much everything that's seen here, including a stabilizer, a connector, needle, and a needle vise. After the site is obtained, there is a sharp needle that is removed from the device, and this must be disposed of. The needle vise gives an alternative place to put it until a sharps box is accessible. We also train on the most current model of CPAP. This device has dramatically reduced the number of intubations performed in the community, as well as decreased infections and complications that are associated with intubations. We perform a lab on pig lungs that allows the students to visualize the impact that such a device has on both the patients and their lungs. I often tell our students that we must practice just like we work. To make the simulations as real as possible, we use a simulated ambulance box that has live streaming capabilities that allows the remainder of the class to watch the simulations in real time in a separate debriefing room. This ambulance is set up much like the ambulances in which the students are required to do their rotations. This helps relieve some of the anxiety that comes with being in an unfamiliar setting. The students get ample practice using the stretcher as well as proper lifting techniques of the patient. They practice lifting and moving approximately 200-pound mannequin to ensure that they'll be able to do so whenever they're turned out on their rotations. At the beginning of each semester, I break the students into partners. These partners are responsible for working together in simulations. The simulations take place every morning with the briefing of the simulations directly after. These simulations get the students thinking as well as address objectives in real-world environments. As with nearly every class or subject, there's always different learning styles that each student learns best from. Some students may be visual learners, while others might be auditory, kinesthetic, or analytical learners. Using the simulation allows me to connect with each of these students no matter their learning style. Again, we try to give the student as real life experience as possible so that when they finish the program, they'll be ready for a career in emergency medicine. Some of the improvements that we're looking at implementing this next semester includes iPads and the iSimulate. Each student will be issued an iPad with a keyboard case at the beginning of the semester. They will use it in class to document their skill proficiencies that are required by both the state and credentialing bodies. They will also be allowed to take these iPads on their rotations and document during the shift. This will allow for the preceptors to proofread each of the students' work prior to submitting, as well as increase the accuracy of this documentation. It will also help relieve some of the burden of the student workload. The iSimulate is also an Apple product. This software package consists of 2 iPads, a case that resembles a cardiac monitor, and a router that connects the 2 devices. One iPad is slid into the cardiac monitor case and has 3 different interfaces consisting of an AED, a regular monitor, and a cardioverter/defibrillator. This allows for the single device to be used in the education and simulations of all EMS students regardless of their level of training. The second iPad is for the facilitator of the simulation. It allows them to choose from pre-programmed scenarios, develop their own scenarios, or adjust the scenarios in real time. Every vital sign from blood pressure to end-tidal carbon dioxide readings can be displayed, adding realism to the simulation. In the past, simulations were limited to a very small set of pre-programmed cardiac rhythms that were very easy for the students to memorize and become complacent with. This technology, which has a vast bank of different cardiac dysrhythmias, forces students into learning the rules of the cardiac rhythms instead of simply memorizing a few generated rhythms. Its hands-on interface also allows the students to progress through the scenario and perform defibrillation, cardioversion, and cardiac pacing in a safe manner. The cardiac monitor can be applied to either a real or simulated patient with no electricity being conducted, which again allows for a sense of realism in the scenario. All the interventions are time-stamped and can be exported to use in the debriefing process. We'll now hear from one of the paramedic students that is wrapping up her paramedic program, as well as a student that is about to begin his last semester of the paramedic program, to hear how some of these changes have impacted them.
Hi, my name is Madison Wester. I'm finishing up my last semester here at South Plains of the paramedic program. And today I wanted to talk about the Sim Center and how I think it's benefited not only me, but all of my classmates as well. We've used the Sim Center for about a year, I think, real intensively. We've gone up every single week. We run simulations with just partners or with large groups. And I think it's really helped us be able to understand what it's like to be really in the field and really assessing patients and real people. We use real patients as well as the mannequins that are up at the Sim Center. Using real patients is sometimes difficult because they can't really change their aspects of their condition. They can't make their skin turn pale, they can't make their lips turn blue, they can't change their heart rate or make their pulses disappear. And that's kind of where the mannequins pick up the slack. You can change everything about the mannequin. You're able to check a blood pressure, listen to lung sounds, check their heart rate, and the people in the control room can change all of those things so that you can actually be taking real vitals on a real condition and practice how that changes. So using the mannequins up at the Sim Center has really helped definitely myself, and I'm sure some of my other classmates too, be able to practice assessing a patient and really understanding their patient presentation. Another thing that I think the Sim Center has been really beneficial about is being able to allow us as students to practice our skills. There are certain skills that you can't really practice on a real person. You can't practice intubating them, you can't practice IVs or IOs without inflicting a lot of pain. So definitely being able to practice on the mannequins has been super beneficial in our learning and in perfecting our skills. You're also able to move the mannequins and place them in positions that you might find real patients in the field, because you're not always going to get a mannequin laid out perfectly on the table for you. Sometimes they're going to be upside down or on their face or like bent in certain ways. So it's definitely a great thing to be able to practice on positions that you wouldn't normally find. I think the last thing I want to talk about is we have recently gotten a car that they have parked outside the Sim Center, and that's definitely helped in learning how to extricate patients or assess patients who are possibly entrapped in a vehicle. It's also helpful to teach us students how to behave around a potentially dangerous NBC incident, which can be unstable, and you need to really learn how to maneuver around certain dangers and be able to take care of your patient at the same time. So the Sim Center, I think, has definitely improved my skills and my assessment abilities as a paramedic student. which I can definitely take into the field and utilize on real patients every single day. Thank you.
Hi, I'm Samaje Ko, a current paramedic student in the South Plains College EMS program. I believe that this new technology being introduced will help the upcoming students grasp what's expected not only in the classroom but in the real world. As I was going through my basic class, we were very limited on what we could utilize and what we could use for scenario-based situations. And I was a very kinesthetic student, and it really helped me if I was able to be physical and touch the patient or the mannequin to get a better picture of what I was actually going to do. So if I was going to like push a drug, I wanted to be able to touch, draw it up, and actually push it, not only just verbalize that I was doing it. I needed to do that. And with going into the paramedic program with Braddock, I was able to do that. We were able to sit down and actually learn how to draw up the drug, push the drug, how fast you needed to push it, and what it actually did to the body. And with the new monitors, you'll be able to see that and treat what's on the monitor. So if you have maybe an SVT, maybe draw up some adenosine and push that at a rapid pace, and you can see that on the monitor whenever your instructor or preceptor changes it on the monitor. You'll be able to see the changes. Some of the other students were, myself and the other students were able to utilize the ambulance as well and be able to load the simulated patient onto that ambulance and actually treat them in the back of an ambulance like you would in the real world. And that was another great idea and great thing that they had introduced. So we were very fortunate enough to utilize all this new equipment. So I think it'll be very beneficial to not only me, but other students in the upcoming years or semesters. So yeah, I believe that the South Plains faculty at the EMS portion of it have made great technological advances that will not only give students now, but in the future, a better perspective on what's to be expected in the real world.
If you have any questions about our EMS program, the changes that we're wanting to implement, or interested in getting in the EMS program, feel free to email me or give me a call at 806-716-4877 or email me at the email provided. Thank you.